environment to test the in vitro activity on several biochemical pathways, and then the double clinical trial on 40 volunteers with oily and acne-prone skin was done. The experimental setups are here reported, and for the in vitro assays we used human immortalized keratinocyte and human dermal fibroblasts. Then results suggest that the caffeourtinic acid derivatives are the most representative class of phenols, and more precisely that the chlorogenic acid is the most concentrated phytochemicals that we have found. By the in vitro outcomes, we obtained that the extract is able to reduce the induced activity of the 5-alpha reductase enzyme, even in a more potent way than the result obtained with the finasteride that was used as a positive control. 5-alpha reductase is the key enzyme in the sebum output increase, so its inhibition was a desired outcome that we obtained. Then we also investigated the ability to increase both expression and activity of the kallikrein 5, that is the trypsin-like serine protease that it's involved in the pore, in the skin desquamation and the hyperkeratinization. So its activity can avoid the pore clogging. That is another skin concept with acne-prone skin. So anti-inflammatory activity was also proved because the extract can inhibit the expression of the all analyzed cytokines. And after that, we also proved the action on boosting collagen. Collagen is important because it builds the wall around the pore and is involved in keeping it in their structure, in their shape. As I told you, the clinical trial was conducted on 40 volunteers that were randomly divided into two groups, placebo and active group. The active group was treated with a 0.5% of the severe Cirsium myrioforum extract. They had to apply for 4 weeks on the whole face, twice per day, the assigned cream. Then the skin parameters were registered at the baseline and compared after 2 and 4 weeks. The active cream showed a really highly sensitive decrease of the sebum production and of the number of the visible pore, as the panelist photos are showing. Another important action is about the normalizing activity that explains the extract, because it can reduce also the transepidermal water loss and increase the skin hydration that are commonly alterated with the hyperseborrhea skin concepts. So we can state that this active is a good as cosmetic ingredient because showed anti-inflammatory and sebum normalizing activity, inhibiting the expression of the most important essential markers that are altered in these skin concepts, and the in vitro outcomes matched with the in vivo ones, and this belongs with the higher phenols content and more precisely with the high chlorogenic acid content. So it can use in alleviating the condition related with acne-prone skin because it improves skin manifestation, exfoliates and smooths the skin, helping to not alter the already compromised skin barrier. The third topic was about the development of a topically releasing butyric acid compound, and also we demonstrated its soothing and anti-reddening activity. Butyric acid exhibits relevant peer-reviewed anti-inflammatory and soothing action, but it is purely used in cosmetic field because of its unpleasant organoleptic properties. To overcome this, we have developed and its derivative, topically releasing the butyric acid, that is phenylalanine butyramide. First of all, we determined the log P using a shake flask approach following the European guidelines. Then its skin permeation was evaluated through the in vitro test on pig model using cell France to ensure its safety as cosmetic ingredient. The characterization of the permeated active compound across the different skin layers was determined through a validated chromatographic technique. Then we formulated the cream containing 1.5% of this active ingredient and tested it on skin-induced erythema upper forearms of the panelists. First of all, we detected the baseline erythema index, and then we controlled it after 30 and 60 minutes. We also controlled the erythema index variation in a control site and in a placebo-treated zone. The results suggest that FBA is a lipophilic substance, and this, joined with its low molecular weight, can suggest that it is a really good potential cosmetic ingredient. The amount permeated across the skin after 1 and 4 hours was only 0.2 and 0.4%, and this is a good result because it suggests that butyric acid could be quickly released by its derivative. And this delivery occurs thanks to the amidase and skin pH. Butyric acid, once free, can act as soothing action. As I have told, the erythema index was also detected on control and placebo-treated area, but the FBA-treated area showed a mildly significant decrease variation of the erythema index. So the method showed accuracy and precision. The FBA is a safe ingredient because it doesn't reach the bloodstream, and it's effective because it releases butyrate that, once free, can interact with its receptor, modulating and negatively modulating the cytokine, pro-inflammatory cytokine release. On the same line of the previous study on Cirsium erioforum, ficus carica stem cells was investigating to work as an anti-stress for human skin. Skin is the most exposed organ of our body, and its health is continually threatened by different conditions. One of the recognized skin aging potentiators is stress. Stress can also affect the skin in several ways because it increases cortisol, leading to collagen breakdown or elevated sebum production, impairs skin barrier, changing its skin texture and leading to loss of moisture and tone. And finally, it can exacerbate skin corners, leading to acne, rosacea, rashes, etc. Our aim was to investigate the potential activity in alleviate the skin damage, psychological related with the skin cells, through in vitro assay on human keratinized tissue, and also on skin explants. Then also an in vivo double-blind clinical trial was done. And this was really interesting because it was conducted on 40 pharmacy students that were undergoing a stressing period that was represented by the examination week. The baseline skin parameters were recorded when they was returning from winter vacation, that was represented by a relaxed period. Then in the acute stress time, they were rechecked, and after, when the recovery time overcome, thanks to the breakdown of the examination period, we checked again all the parameters. By the in vitro outcomes, we found out that the extract attenuated the CIMP synthesis, so it can negatively affect the signal pathway epinephrine related. Consequently to this action, we also find out that the expression or the synthesis of the inflammatory cytokines interleukin 6 was reduced. Then we also investigated the ability of the extract to fight the lipid and protein oxidation in keratinocyte. And also we investigated the less lipofuscin accumulation that is a problem found in the stressed keratinocyte. Activity was also proved on human skin explants, not only on immortalized keratinocytes, and these are in accordance. After that, we also tried to find if the extract was able to replace the ceramide that are the most important compound building the hydrophobic skin barrier, and both the GBA gene expression and the ceramide content were replaced. So we can conclude that the extract alleviates the negative effect of the stress hormone activity, because also in panelists was found that the skin barrier was recovered because the level was reduced. The sebum and the squamation was lowered because we detected less of this value. We also demonstrate an increase in the skin brightness, and this is in accordance with the reduction of the lipofuscin that was detected in vitro, and also an anti-reddening and normalized pH action was detected. The active belongs to the polyphenol content in the extract, and also to the fission content that is rich in the latex. The fission has a papain-like activity. Then we developed for the cosmetic.
Su Teams.
Non è che entravo perché stavo assunto.
Prova di nuovo, se no al limite ti do la mia e entri tu, amore. Che poi io prima ci ho messo a botanico diversi e poi vedi qual è quella giusta.
Aspetti.
Prego le persone che stanno seguendo da casa di controllare che i microfoni siano chiusi, perché sennò disturbate la presentazione dei candidati. Mi raccomando. Scusaci.
Then we developed for the cosmetic company due this pandemic situation an empirical method to prove if the developed makeup products are really mask proof. That is the new no transfer concept. I want to focus on my period as visiting PhD in Spain at the Institute for Advanced Chemistry of Catalonia. Here I was involved in the study of the lipids role in the aging process. A clear sign of aging is loss of color, that state that the hairs are turning gray or white, and this due to the lack or degradation of the melanin content. But at the same time, also the lipid content in there can be altered, and we demonstrate this. The most important objective was to analyze the aging through the lipid analysis. And to do this, we characterize different lipid content in brown and white hairs. And after that, we also extracted in separately way the external and the internal lipids to understand their different behavior in both hair types. The methodology provided for the separately extraction of the external and internal lipid using several organic solvents. After that, the fraction were analyzed with TLC feed. The TLC feed reports different important outcomes. The first was about the external lipid, because we detected no significant differences between brown and white hairs. But on the internal lipids occurred differences, and more precisely, brown hairs showed a more free fatty acids and polar lipids content. Then we also conducted a thermogravimetrical analysis to understand the lipid properties. Commonly, two peaks occurs in a TGA spectrum of a spectrum, but here we have also another peak in the brown hairs that occurred at 425 gauge. And also the peak that is normally around 330, 340 is really higher in brown hairs instead of the white one. These two results suggest that there is an highly saturated fraction in the brown hairs. So the lipid content is less in white hairs. We also detected less free fatty acid and polar lipid and a less saturation degree in white hair. After the lipid extraction, the hair fibers were analyzed. And we have done it through the ER spectroscopy. The ER spectroscopy is important because suggests difference in the lipid chain behavior. Because the wave number suggests the order, the lipid order. Because when the lipid order is high, the lipids are in a more compact organization that is called the orthorhombic. When this lipid order increases with the wave number, we have a more fluidity in the air structure because they are organized in hexagonal or like a liquid crystalline way. Also, this technique can quantify the amount of lipid detected because when the peaks are higher, this is the outcome of a more lipid content. And by our results, we showed that in the external and the internal lipid, the lipid amount and the order in the external and internal air extracted, we have less order. But also in white, this trend decreases more than in brown. The DBS analysis suggests how the substances can arrive or depart from the inner side of the hairs. And we found out that the brown hair have a high water regain, so they can interact higher with the water, and this is correlated with the high melanin content that is a well-known hygroscopic molecule. Then, after the internal and the external lipid, this behavior changed because after the external lipid in both hair types, the water regain decreased. But after the internal, this parameter is reverted. This is because the internal extraction make the inner hair fiber more polar, so more water can be retained in. What about diffusion? White hair represents higher diffusion. Diffusion is also alterated by the external and internal lipid extraction. Diffusion is higher in white hair, maybe because its lipid organization, as we have seen with the lipid amount order, was altered. So maybe also the property to diffuse substances is altered. Here I have summarized all the explained results. So what about the hair fiber? We can see that the white fibers have less content of lipid, less lipidic order, less water content, and higher permeability compared with the brown. So the lipid content difference and the fiber property difference suggest us that it is important to develop tailor-made formulation for each hair type. The final topic was about a work in collaboration with the L'Oréal Research Innovation Group about the identification of the key drivers that influence diffusion between Caucasian and Chinese. I cannot report the results obtained because they are protected by a confidential agreement. Thanks for your attention.
Okay, thank you for your nice presentation. We can start with questions. So we can ask Professor Santi to start with the first question.
Thank you very much. And congratulations for your work. I really enjoyed it. I really enjoyed reading your thesis. Probably also because I work more or less in the same field. And congratulations also because all the amount of data that you could collect despite the pandemics. I just have a couple of questions. One is related to your first chapter, let's say, the use of snail mucus, which is very interesting because today is a very popular ingredient in cosmetic products. And it's interesting because you also characterize the presence of specific molecules such as allantoin and glycolic acid. My question is, all kinds of snail mucus contain the same components, or is it specific for some kinds of snails, as far as you know?
Yes, these snail mucus are provided for in common breastfeeding companies. But what we have found out, because we detected the different amount in 3 different snail batches, the quantity may vary because it depends from the breastfeeding condition, also nutrition of the snail, the age when the collect was done, and so on. That's why we have chosen it in a specific time and with specific breastfeeding criteria. But what we have stated that is the relation between allantoin and glycolic acid could also reveal different behavior on human skin, because that's why I have underlined my results in the key of the glycolic acid and allantoin content, because if we see the amount detected, we have found that we have more glycolic acid than allantoin, and that's why we expected to have after 1 hour an increased table value with increasing glycolic acid content in the snail mucus. After that, the allantoin content reversed this condition, leading to more skin water because it is less concentrated in the 2%, but it's high in the 10%. So we can conclude that, yes, there are differences. And for this specific kind, with these specific properties, we have found out the correlation between table and glycolic acid and allantoin and skin corneometry.
Mm-hmm. And can you tell us your opinion in this sense? What is the advantage of using snail mucus compared to using allantoin and glycolic acid as pure ingredients?
Yes. It is important to use the snail slime because it not only contains these 2 active ingredients, that are also other bioactive molecules like hyaluronic acid, glucopolysaccharides, that can explain a good action on skin in not only recovering the skin barrier and increasing the water content, but also stimulating hyaluronic acid synthesis, stimulating collagen and elastin to giving skin more tone. So it's important to use the snail slime and not only the allantoin and the glycolic acid.
Okay. I just have a very short question to conclude. It's very interesting also in chapter 3, this new molecule associating butyric acid with phenylalanine, if I don't remember well. Do you know if besides the biological action that you mentioned on butyric acid acts also as a penetration enhancer, as do other organic acid?
Yes, normally the short chain fatty acid can explain this action, and its low molecular weight make it a good candidate, and also its lipophilic balance make it a good candidate to penetrate the skin through transepidermal via. So that's why it is highly used also as an answer of the cosmetic ingredient, and not only also for drugs, for example. But we have also found out that, for example, active enhancer of penetration are compound like the hydroxypropyltrimonium, for example, that has this short chain with a delivery system that was represented by the ammonium group in that case. In this case, we have the carboxylic acid, no? And this could lead to most penetration because also have to interact through an electrostatic way with the building structure of the skin.
Okay, thank you very much. I'm done with questions. Thank you.
Thank you, Professor Santi.
Thank you for your presentation, which clarified some issues that you raised in manuscript. And in the beginning, you are stating about the strategies that are being used now to evaluate the activity of substances. You mentioned in vivo. What about the in silico? What is your opinion about the potency of modeling for this complex approach to the identification of positive bioactive substances?
Yes. In silico is the future because it's important to find alternative way to test cosmetic ingredients without using human cells or skin extracts. But in my opinion, it can be used always with an in vivo proof, because as we know, the in vivo has a large variety of mechanisms that are behind a single or repeated product application. The first problem, for example, in the differences, the advantages of the silico instead of the in vitro, for example, is about the possibility to prove the final cosmetic formula that is impossible to do in vitro because of the mortality of the skin cells instead. But the in vitro model or the in silico model are not enough, in my opinion, that to explain the real effect that we observe in vivo. Because there are differences also in the amount used by the human beings. There are differences leading to the variability between inter-individuality, inter-racial diversity, and so on. So for me, it's important always to corroborate data.
Okay, thank you. In your thesis, there's an enormous amount of work, so I have to congratulate you and your team. It definitely shows a multidisciplinary approach to the final outcome now, which I think to have extracts or substances that have some advantage for society and commercial. What is your impression of the complexity that the challenges represent? Because the first question was very interesting. Is the snail movement? You responded very clearly about accompanying substances, but when it comes to the identification of the natural compound and eventually the purification processes, because you work, what do you think is the importance of purifying the extract to get rid of undesirable substances?
Yes.
Or, tackle better purified substances that may be better off. What is your impression of this approach,
Yes.
And specifically for purification of compounds?
Okay. We have to say that nowadays clean beauty or clean cosmetic is really in vogue in this period, because it thinks that purified cosmetic ingredients are always natural, but we know that it's important to purify also natural ingredient to assure the real clean product, because there are not only the desirable compound in our natural product, but also skin irritant, pollutants, and chemical environmental presence in. And this can really alter the skin, because skin is sensitive and it can interact with everything around us. And this compound can also make to exacerbate rashes or provoking erythema. And that's why it is also important when we formulate a cosmetic ingredient to ensure that it's dermatological safe. And this is possible to do using, for example, patch test. This because I think that natural is a good strategy, but more than natural, it's important biosustainability that is completely different, because we can have few natural compounds, but one green and another one no. That's why we also promote the use of stem cells, because stem cells are collected in a green way, because non-agricultural land are exploited. They grow in a really sterile and optimal condition without the contaminant interactions. And most of all, that is a real important focus in this moment, it's about the possibility to make it growing without a lot of water consumption. That's why we suggest this kind of natural that is completely different from the marketing topic like green or bio, for example.
Okay. Then one more question related with your profile, because your thesis has an enormous spectrum of methodology, from botany to extraction procedures, LCMS, in vitro assays, biochemistry, gene expression. Where do you feel more comfortable in this field? Because after reading your thesis, I wish I had your CV, because I didn't know who I was going to be. And the question is, what do you think your contribution can be in the future? In which part of all these methodological mixture, and what was your opinion or your largest contribution to the thesis from a methodological thought?
Okay. To answer to your question, I want to make the focus, for example, on the study about the ficus carica stem cells, because here I can explain better my approach. I want only to make the slide to make more clear what I'm going to tell. For example, my expertise is about the clinical trial on human. But in this period, I have also improved my ability to predict what we can expect after knowing the chemical compound of an active ingredient. For example, in the ficus carica, we have found out that the epinephrine is the most important stressor. And when its production it's increased in stress condition, we have different skin concepts. But more precisely, when I found out, for example, that the lipofuscin, that is a pigment that normally we found accumulated in keratinocyte, my expertise entered because I can relate this with the in vivo results that I want to underline. For example, the skin brightness improvement, because lipofuscin is a pigment and makes skin turning pale. If I would I won't have this knowledge, I would be not able to correlate the lipofuscin accumulation result with the in vivo expected outcomes, for example.
Okay, so it was really important for me to so I understand that your projection is from an integrative approach
yes.
of all different. Now I will ask you an easy question, but a little tough. So are going to be a PhD at University Society.
Yes.
Why did you do chapter 7?
Yes, more good critics are accepted, obviously. No? Why? Because even if I cannot report results, it was really important for me to work with such an important worldwide known companies like L'Oreal. Not because for the marketing aspect, but because it is maybe the only company that has a so developed research and innovation group. They work always alone, without sharing results, without sharing also methods. That's why it was important for me. And it was also important because understanding the differences between hair types that are similar and not so different like the white and brown, make me more able to understand the height differences. Because between Caucasian and Chinese, there are really a little differences, and the data are so difficult to read. We had to repeat it several times. And I think it's important also to explain that I have worked on this, even if I cannot share my results.
Yes, very clear explanation and the novel approach of your chapter, the quality of your exposure. I'm not taking that from an academic perspective. It's about the manuscript of a thesis, what the validity wants, we want the academic work, our result conclusion.
Yes.
So maybe you could perfectly cite this line of work, a global discussion, I think, but it's a little strange to have a chapter.
Yes.
But
yes.
As I said, the amount of work and quality of the other chapters for the other. Okay, thank you.
Thank you.
So I also have some questions. So the first is about your chapter 1, so on the snail mucus. And you wrote in your chapter 1 that probably the way it works, allantoin, is by using the chromosomal contacts between cells.
Yes.
And from a biological point of view, that is mostly my background, this is not always good, especially when skin is suffering and is close to neoplastic transformation. So I'm sure your patients were all healthy, but
yes.
What about the effect of allantoin on skin moles? So do you have any idea if there is any side effect of allantoin or snail mucus on skin moles?
Always cosmetic ingredient has a safe range of use. Allantoin didn't show some rashes or problem also in skin molds. But it's always important to prove this through dermatological test, for example, in vivo, or we don't need to test toxicity in cosmetic field because they don't have, following according to the European regulation, they don't have to reach bloodstream. So we stopped our analysis always on the skin use in vivo or in vitro, but we don't demand about other side effects that could be implied with for example, the development, the delivery of the substance. Because if an ingredient is retained safe for the regular commission, we can use it in the cosmetic ingredient and we don't need to test toxicity, for example.
Okay, the second question is about the chapter 2. So you said that as among the example of 5 alpha reductase inhibitors, finasteride. If I recall correctly, one of the side effects is of finasteride is eye body growth.
Mm.
So in your clinical trial, did you see if your extract promoted hair body growth?
No, because this is in the same line with the previous answer, because it's not requested for the cosmetic field to prove this kind of toxicity, for example, cytotoxicity or...
I mean, hair body growth.
Hair body growth. Okay. No,
it is more like cosmetic
okay.
side effect.
Okay, so for the human test side, not the in vitro.
Yes.
Okay, I understand. For the human side, we have monitored always with a physician, the patients, because we are talking about acneic and acne-prone and seborrheic skin type. So the physician doesn't underline this side effect. And also after the clinical trial, we, besides of the clinical visit, we also asked for self-assessment to panelists to ask if they note side effects, because they are always free to leave the study, for example. And this side effect was not registered.
Good. My last question was about your chapter 3.
Mm-hmm.
So you wrote that FDA is cleaved by a skin amylase into its component,
yes.
so butyric acid and the amino acid. And then I got lost, because if the main function of FDA is to not have the side effect of the odor, unpleasant odor, when it is get cleaved by amylase, then the hot odor does not come back.
No.
Because it's inside the skin.
Yes, exactly.
Thank you. Okay, we come to the candidate, and one with the second candidate is Christopher Loeffler. He will present a thesis entitled Ciguatoxin and Ciguatera Poisoning Forecasting Risk, Method Development and Applied Outbreak Response. Please, just a moment, that for security reasons I have to spray a bit the microphone.
Can I begin?
Yes.
Yeah. Is it possible to use the change the date? No trouble. I'll use it. Yes. You may want to. No. Okay. Thank you, everybody, for being here. My name is Chris Hutler. I'll be introducing my thesis topic entitled Ciguatoxins and ciguatera poisoning, forecasting risk, method developments, and applied outbreak response. I'd like to begin today with the motivation for this thesis. It's that foodborne diseases are widespread and very important. About 1 in 10 people every year fall ill to a foodborne disease. About 420,000 people die. Ciguatera poisoning is a foodborne disease, and it is responsible for up to 500,000 illnesses reported globally. Therefore, the World Health Organization, the FAO, various other health organizations recommend a One Health type approach. This means collaborative efforts working together, looking at this problem from environmental, biological, and human health approaches to tackle a problem such as foodborne diseases. So how do you get ciguatera poisoning? Well, if you're unfortunate enough to encounter a seafood product that contains ciguatoxins and you consume this product, you can expect symptoms of ciguatera poisoning between 1 and 48 hours. These begin initially with gastrointestinal distress. This is followed by neurological problems. Currently, there are 175 distinct symptoms associated with ciguatera poisoning. In extreme cases, coma and death have been reported. Some of these symptoms can last for days to months to years. So this is a very serious intoxication. Where does it come from? Well, there are two types of microalgae in the genre Gambrinodiscus and Copiula. And these two genera of microalgae can produce a wide range of marine biotoxins. These include mycotoxins, gambrintoxins, and ciguatoxins. These microalgae are benthic dinoflagellate, meaning they grow on the bottom of the ocean. They usually cover macroalgae, so they're epibenthic microalgae. This is problematic because algae are the base of the food web. So as you can imagine, and anytime you've been in the ocean, you see algae wherever you go. Well, these epiphytic dinoflagellates grow on top of this algae, and as fish or other marine organisms come by to graze in this algae, they inadvertently consume the dinoflagellates that are growing on top of the algae, therefore incorporating the toxins that are produced by the microalgae in the flesh of the consumer. As larger predators eat those primary consumers, they too consume the toxins that are contained within this first level of grazers. This moves up the food chain in a bioaccumulative effect where the largest predators can contain the highest amount of toxins. There's also biotransformation pathways that are involved in this process, modifying the compounds as they move through the food web. So ultimately, the top order predators become the highest risk for the consumer, which are people. I want to make clear that this is not a food processing problem. This is not something that's introduced for food handling. This is inherent in the flesh of the organisms. So you can think of it as similar to mercury. So because there are such a wide range of metabolisms of organisms in the ocean, there are a wide number of analogs that have been reported for ciguatoxin. One thing that these compounds have in common is that they are lipid-soluble polyether compounds with between 13 and 14 rate. These compounds are extremely stable. They're resistant to changes in heat. So this includes freezing, cooking, as well as acidic and basic conditions. So there's no way to cook or prepare the toxin out of the product if it's inside the product. I want to make clear that there's only two commercially available standards. These are CTX3C and CTX1B. So among the 30 analogs known, there are only two commercial standards. Where can you find these toxins? Well, simply it's a global phenomenon. So anywhere where you see color on this map are areas where either a ciguatera poisoning has been reported from locally consumed seafood products, or environmental analysis have captured animals and tested them for toxins and found ciguatoxins present. I want to highlight two endemic regions, Hawaii and Vietnam, which will be the focus of my chapters 2 and 4. They're highlighted in black boxes. So when somebody is unfortunate enough to get ciguatera poisoning, and we are fortunate enough to get a meal remnant to do the analysis on the sample, or an environmental sample was present, we go through a long extraction process. This is primarily entails a number of liquid-liquid extractions, followed by a solid phase extraction. At the end of this process, we have a semi-purified compound that is suitable for the analysis of ciguatoxins. Currently, the U.S. Food and Drug Administration recommends a guidance level for the consumption of ciguatoxins in seafood products. For ciguatoxin 1B, this is 0.01 micrograms per kilogram, so 0.01 ppb, if you will. And for Caribbean ciguatoxin 1, this is 0.1 micrograms per kilogram. Very, very low levels of detection are required. And therefore, we use a two-tiered analysis approach. Tier 1 is a toxicity screening assay. In our case, we use the Neuro2A cytotoxicity-based assay. It's based on the mouse neuroblastoma cell line. And this functions to detect the mode of action of ciguatoxins. This will be the focus of chapter 3 and a lot of my research. Once we have a positive sample in the toxicity screening assay, we move towards confirmation of the compound that was responsible for the toxin detection in tier 1. And this includes liquid chromatography, tandem mass spectrometry. So tier 1 for the toxin screening assay, this is based on the ciguatoxin's mode of action. And the ciguatoxins bind to site 5 of the sodium channel, voltage-gated sodium channel. This binding causes activation of the sodium-potassium ion pump, modifying the voltage dependence across the membrane. This leads to sodium ions entering the cell swelling, and it can die. Therefore, we use an endpoint MTT-based assay. This is absorbance based on the ELISA plate reader at 570 nanometers. Just for your reference, whenever you see a well with a purple color, the purple indicates that the cell is alive, active metabolism is present. Without the color means the cell is dead. So just to briefly run through the assay itself and some of the data that you'll see throughout this presentation. Anyway, we use Wabin and Veratridine, O and B. These are two pharmaceutical compounds that can be described as a signal booster, if you will. The EC50 is the effective concentration for 50% of the cell's death. We use an 8-point dose response, so we use 8 points of concentration through our assay. And there are 4 steps to this process. So culturing the cells, seeding the cells, dosing the cells with compounds, developing the plates with the MTT assay, and reading the plates with an ELISA plate. So this is an example of a 96 well plate that we use for this assay. It is divided into 4 sections. Top left is a control, just to see how the cells perform over the 48 hours of the analysis. This is just to see how the cells are doing and how they handle the process. Then we have our control with just our sample application at the 8 dose responses. This portion of the plate indicates to us whether there is something that is non-specific in the extract that we had, maybe. Then we have the Wabin Veratridine only portion. This is to ensure that the pharmaceutical compounds that are needed for the detection of sodium channel activating compounds are not having a negative effect on the cells, inhibiting our ability to analyze the samples. And then we have our primary portion of the plate. This is the addition of the Wabin and Veratridine, our signal booster, if you will, and the addition of our sample. This is where we can detect sodium channel activation. The results of these 2 sections give us the controls and our experimental, and that tells us the viability of our cells compared to. You'll see that on the y-axis. And these two portions, the top without Wabin and Gratchinin and the bottom with Wabin and Gratchinin, are producing two curves. With the addition of Wabin and Gratchinin, if we have toxicity, we use a sigmoidal. This is what the developed plate looks like after the analysis, after the reading with NTT. And again, we're looking for the effective concentration for 50% of the cells. We can use this in an unknown sample and compare this with the exact same type plate with a standard, and that way we can describe our unknown sample in terms of a known concentration with a standard. So moving on to tier 2, so once we've established that a toxin is present, we go to qualitative confirmation of cytotoxins using LC-MS. So we use liquid chromatography to separate out all the compounds that are within the sample, and then we use mass spectrometry to look at what compounds are contained in there that may be of interest. We use a screening assay, which is based on the sodium atom of the cytotoxins, and confirmation using ammonia. We use both low and high resolution MS for the confirmation of the ammonium adduct. And then we also do identification based on the mass to charge ratio of the compound, the retention time, and the intensity of the signal. All of this and more can be found in Chapter 1, which is published in the International Journal of Environmental Research and Public Health. Chapter 2, which is focused on forecasting risk, is published in the Journal of Environmental Research. So the island of Hawaii is known to be an endemic region for ciguatera poisoning. The CDC recognizes it as such, and there's been over 1,000 cases of ciguatera in the last 20 years in this area. This is a very serious, severe problem. We wanted to look at if we can find environmental factors to be used as predictors for toxicity in seafood products. We use Cephalophilus argus, which is as our target species for this analysis to keep the diversity of samples low in terms of the amount of compounds and variety of compounds that we may identify. Cephalophilus argus is an invasive species that was introduced in the 1950s to create a fishery in Hawaii, but because of its association with ciguatera poisoning, the fishery has collapsed. And because it's an invasive species, it's not recognized by local fish endemic species as a predator, and therefore this species has exploded in population and has basically taken over the reefs of Hawaii. So it's problematic. People want to fish this species to keep the population under control. However, people don't want to eat it because of its association with ciguatera. So we use this as our focus species, and we collected 113 samples from 2 different regions around the island of Hawaii. We also collected the viscera, the internal organs for 16 of these samples. And we found that 76% of the fish that we tested were positive by the M2A assay. 33% of these samples were confirmed to contain ciguatoxin 1B, and all the samples that were tested by the assay were found to be in excess of the FDA's recommended guidance level of 0.01 micrograms of ciguatoxin 1B per kilogram of fish. We looked at the size of the fish in relation to the toxin as well. This is important if you are a fisher and you collect a fish, you can use these morphometrics to guide you on whether or not a species may be a risky species to consume or a risky organism to consume. We found an association both with the length of the fish as well as the weight of the fish with this association of ciguatoxin. We also found that the locations that we sampled from were distinct for their toxin accumulation, toxin fish that we sampled. So 95% of the fish that came from the western side of the island were all toxic and ciguatoxin. This was about half in the eastern location. These 2 areas are distinct for a number of environmental factors, including wave action, the coral cover, temperature, the amount of rainfall that washes into the ocean, so salinity content. So all of these factors can contribute to the either increase or decrease in the amount of Gambia discus, the positive microalgae that grows in these areas. So the goal is to use some of these remotely observable factors, wave action, and so forth and so on, to predict whether you might have more or less toxin in a region. Currently, there is no way to tell if there is toxin in the fish before consuming it, unless you have extensive analytical analysis capabilities. There's no stick test or fast way to test for citotoxins before eating. So something that is useful and remotely observable is important for the fishermen. Chapter 3 deals with method development, and this is published in the Journal of Harmful Algae. So the N2A assay it's a very useful technique. It's more sensitive than the mouse assay, as well as some of the analytical techniques, but it has some drawbacks in terms of its detection and repeatability. So I went through a couple of methods to work on standardization and quality assurances to ensure that I'm interpreting this data correctly, and I have the best opportunity to detect citotoxins using this method. So there are two important factors when applying this assay, and that's the amount of wabbing and ratcheting that you use, so the signal booster, if you will, and then the number of cells that you use per well. There are several quality assurance that you need to use when applying this assay. This includes keeping track of your sensitivity of your cells to wabbing and ratcheting, and maintaining a window of sensitivity to these two pharmaceutical compounds. As well as keeping a low standard deviation. You want to make sure that you have repeatability among plates, as well as within plates, repeatability within replicates, and also to use standards. So both, it's important to use commercially available citotoxins, as well as brevitoxins, which work in the same mode of action as citotoxins, but it's another compound that's commercially. So this is an example of a plate that has the addition of sodium channel activating compounds. But as you can see, the control as well as the experimental portion are exactly the same. There's no difference. So if you were to look at this plate, you would interpret it as a negative response. There's no toxin in this plate. But really, if you were to look at your sensitivity, you would see you have 100% of survival. So there's no cell death due to the addition of wabbing and ratcheting. So this would be an indicator to you that you have a false negative potential. So this would fail your quality assurances, and then you need to see to repeat the experiment to make sure that you can achieve the correct response. So this is without the addition of wabbing and ratcheting. You would expect to see this in this assay. The opposite is true if you use too much wabbing and ratcheting. Wabbing and ratcheting have the same mode of action as citotoxins, so they can activate the sodium channel and allow sodium to enter the cell and kill the cell. So using too much of them can also result in too much death. And again, this plate has received sodium channel activating compounds, but you are unable to see a signal because it's been washed out, if you will, with too much signal of wabbing and ratcheting. So this second part was the issue I had when establishing the assay. So I purchased a cell line that's recommended in the literature from ATCC, established it, and used the amount of wabbing and ratcheting that's recommended in the literature, and I found it was killing my cells completely. I could not see any signal from any known standard, which I should expect to see something. So this was a problem. I couldn't detect any compound. So therefore, to improve, to fix this issue, I went to the cell culture, and I added wabbing and ratcheting directly to the cell culture. So I grew the cells in wabbing and ratcheting positive conditions with the hope and intention of creating a cell selection process where I could establish a cell line that was more resistant to these pharmaceuticals and wouldn't be so sensitive when they are added during the cell assay process. So what happened was I dosed the wabbing and ratcheting, killed the cells that survived. I grew a new culture from that, and this is moving forward with the experimentation. So again, just to recap, the top portion of the assay and the bottom both have the addition of wabbing and ratcheting. The top is the modified cell, and the bottom is the original cell. As you can see, the addition of wabbing and ratcheting kills the cells from the original purchase, and the modified cell line is able to survive in this condition. I went through a number of different experimental approaches to achieve this and to achieve a stability in cell line and to make sure that this process is replicatable. So anybody can purchase a cell line and establish it in the lab and go through this process to create a line that is resistant to wabbing and ratcheting. What I found worked best was 72 hours of exposure to wabbing and ratcheting in 2 applications. So You can do this in a slow or a fast modification process, but again, what I was looking for was a stability between 60 and 80% survival and the exposure conditions that I have preset. And so I found the 72 hours of exposure 2 times was the best suited for modifying the cell line. So now that I have a cell line that is resistant to wide banded ratchet in the conditions that I've set forth, how does it perform in real world conditions? So exposure to commercially available standards, as well as naturally occurred fish. And what I found was that the modified cell line was 2 times more sensitive for the detection of sodium channel activating compounds versus the original Neuro 2A cell line. This was true for both cigotoxin 1B, cigotoxin 3C, so the 2 commercially available standards, as well as brevetoxin 3, which is produced by Carenia brevis. It's another marine biotoxin, but it has the same Site 5 sodium channel binding mode of action as cigotoxin. So putting this together, there was a major outbreak that occurred in 2017 involving red snapper imported from Vietnam that led to 16 cases of ciguatera in Germany. This was a very widespread event. It involved over 8,500 kilos of fish that were imported from Vietnam. And this, a number of outbreaks occurred over a 30-day period until a RAS report was able to be created and presented to recall the product and to prevent further illnesses. From this recall, we received 45 samples, and I applied the extraction and N2A assay to all of these samples. We also received 2 neoremnants that were directly related with the outbreak. All the samples that we tested were positive by the N2A assay, and the average toxicity that we found was 2.8 micrograms of CTX3C equivalent per kilogram. So currently in the European Union's position on cigotoxins is they are not allowed to be present in seafood that is brought to market. So technically all of these samples that I tested would have failed and they should not be presented to the public. To further investigate these samples, so that the N2A assay will tell you that you have sodium channel activating compounds, but it doesn't tell you exactly what it is. So you need to go to tier 2 for the toxin identification. But sometimes you don't have standards available for the toxins that may be present in these samples. So we use bioassay guided fractionation, or we use liquid chromatography to separate the samples to various fractions and use those fractions on the N2A assay, investigating those fractions for sodium channel activating activity. And then we compared that with the Radamon and the LCMS, and we tried to match where we saw toxicity with what we perceived to be cigotoxins. And we found a number of compounds, 6 compounds in the CTX3C group. So we've used a lot of different methods and we've applied different approaches for modeling and for identifying and predicting cigotoxins in the environment to try and help fishers and people that may be researching cigotoxins in the future. We modified the cell line to make more sensitive and more stable cell line for the detection of cigotoxins. But there's still a lot of work to do. So next steps, we have to figure out what was the reason for the modification of the cell line, what did we change within the cell to see a different response, both in the conditions of wild banded ratcheting and also that made them more sensitive for the detection of cigotoxins. There are unknown compounds that we've identified during the bioassay guided fractionation, and they have a strong mode of action indicative of cigotoxins. We are unsure of what these compounds are. They were not present in the 30 known compounds for cigotoxins. So this may be an unknown compound that we have to investigate. There was another outbreak of ciguatera in Germany, in Europe in 2020, and we want to use the same methodology to investigate these samples as well. So our intention is to show that we now have a method established that we can respond to outbreaks quickly and analyze the samples and provide information back, as foodborne diseases are often go unresolved. Many of the cases either are never reported or samples are not provided to an analytical laboratory. So there's no closing of the book, if you will, of an intoxication. There's no compound that you can point to and say that was it. So now with our methodology, we're confident that we can detect citotoxins and we can begin to respond to these outbreaks rapidly with a conclusion and point to the compound that was responsible for intoxications. We also have a number of algal source compounds, and we need to investigate these further. So we have a number of methods lined up that we'll be using to investigate some of the precursors to the toxins that we find in the fish. So throughout this thesis, there have been a number of achievements, including publications as well as oral communications and posters. And I got a job. That's always the goal, right? Yeah, so, but it is all thanks to everybody that has provided resources, provided mentorship, help, laboratory access. It's difficult as a non-European citizen to work in Europe and to move around freely and to, have some different problems than I think European citizens, but everybody has been extremely helpful with the language and everything. So thank you all very much.
Thank you for your presentation. We can start with the question. We can, of course, start with Professor Santi.
Okay, thank you. And first of all, congratulations for your work. Very interesting. I confess I didn't know about these toxins or the problem that they can pose. So I have a few curiosity related really to the toxin. The first question is related to the stability of this class of toxin, because from what I have understood, there are more molecules. Are they I guess they are stable to heat or to pH, since they become a big problem of health, or the toxicity is related only related to the use of raw fish?
Yeah, so that's the problem is these compounds are extremely stable. So cooking, freezing, acidic ceviche, these have no effect on the stability of the compound. So if it's contained within the flesh of the fish, unfortunately you will get it. There's no way to eliminate these toxins before consumption. So they're extremely stable.
This is what I guessed. And you mentioned that the symptoms given by these toxins are very broad. There are a lot of different symptoms. So I guess it's not even easy to attribute the toxicity to this specific food, because some of them related, for instance, to the GI tract may be general. So do you think that this is could be a reason of difficulty in understanding that this is the reason, this is a real poisoning?
Yeah, I think it's very fascinating, the number of symptoms that you hear about and that people report. And I think while it is difficult, it makes diagnosing Ciguatera very difficult. The other side is there can also be opportunities. So if you look at the literature and the reporting, some of these intoxications can be region specific. So if you have an intoxication of Ciguatera from the Caribbean, the patients are more likely to report gastrointestinal disturbances and not so much neurological. Versus in the Pacific, you have more neurological complications and description. So we wonder why. What are the sites of action? What is contained in these compounds? So in the output that we looked at, there's a broad number of compounds that we identified in there that are citotoxins. And each of these compounds may have a different affinity for various parts of the body. So this may be the reason why we see so many different symptoms, because there can be many different compounds contained within a single fish. This can be further complicated by the global seafood trade. So you can find somebody in the Caribbean who was poisoned by an imported fish from the Pacific. So they may be in the Caribbean and they may report a symptomology that is indicative of a Pacific intoxication, and it may be the case that they consumed a fish from that region. So from the perspective of a physician, it can be very difficult to pin this down. Usually the hallmark for civitoxin intoxication is have you consumed a seafood product within the last 48 hours? And then was that seafood product from a warm tropical coral reef associated area? And when the patient may say yes to those questions, then you can say, okay, maybe this was a civitoxin intoxication. But then we still have to retrieve a meal remnant, and most of the time people eat the whole fish or they throw out what made them sick. So it's not often that we are able to confirm what the responsible toxin was. Was it Peruvian civitoxin 1 or CTX1B? But if we can retrieve more of these meal remnants and start to build this database of the symptomology and confirm the toxins, it provides a great wealth of opportunity of understanding the mode of action for these different compounds. So,
yeah, and probably also the number of cases is underestimated for this reason. It might be underestimated. Just the last question, from what I understood, so there are several molecules probably also with a different structure. So the toxins may be located in these different parts of the fish. I was just thinking if toxin localize in fat is probably easy to eliminate then, but probably this is not the case. Am I right?
There have been some recent studies that have come out that have been controlled, and they looked at the depuration of toxins and the metabolism of feeding studies. So feeding the fish toxins and seeing how they move throughout the body, how they're metabolized. So initially, if you have a fish that's clean, if I say, and you feed it toxin, it enters in the gastrointestinal tract, the liver is metabolized, and it moves through the flesh. So you can see a time-based metabolism and accumulation of these toxins throughout the body. And yes, you can find different compounds in the liver versus the flesh. So yeah, it's quite complex. It's also difficult because there's only two standards. So really, all these different compounds that could be in there, it's difficult to confirm with MS because you don't have a standard to match it to it. So you kind of have to do some guesswork, and that's the real, I think, the beauty of using the two-tiered approach is you can catch these problems where you may have a false negative, where you don't see it in the MS spectrum, but it still does have a mode of action that is indicative that could cause an intoxication from the consumer. So yeah, there's a lot of work to do, but it's a very interesting topic.
Yeah, I agree. It's very interesting, fascinating, considering also the spread of this toxicity. I'm done with the question. Congratulations again. Very interesting piece of work.
Thank you.
Hello, I want to congratulate you and you for your work. Thank you. I will ask question in a different order, according to the methodology, and then I will go higher level. To have a chapter on extraction.
Yes.
And Dottorato is confronted with the 1940s, 50s, and we're still working on extraction.
Yeah, that's correct.
We're
not finished.
We're not finished. Why?
Yeah, it's very difficult. Number one, it's a very complex matrix. Fish tissue, the liver. So the starting point that you have to find your needle in the haystack is very complex. And then on top of that, you have meal remnants that can be fried, they can be baked or you name it under the sun, people prepare their seafood that way. So you can not just have a complex fish tissue matrix, but introduction of spices and things that can further complicate this. So your starting point is extremely complex, but the end point has to be so fine that you have to make sure that your fats and everything are removed, or they'll have an impact on the assay. You'll have problems with the matrix suppression with the MS, and we're looking at very, very low levels that we need to detect. So, so the complexity of detection, what we need to look for, what we need to find is difficult. The matrix is difficult, but the laboratory work is also extremely, it takes about 3 days to go through the standard extraction process. There's many portions where you may mess something up inadvertently and don't catch it. That will follow through and you will have a false negative response. You will believe that the fish is negative, but it may just happen that during your liquid-liquid partitions, you may have messed something up or inadvertently recovered the wrong phase. So we're always looking for ways to make this simpler, to make this applicable to a wide variety of situations. And what we wanted to focus on with Chapter 5 was a simplified way to receive the material, so a dry fish. That's another problem, is that the water content of the product varies. And if you are basing your toxicity of the sample on the weight of the original extraction, and much of that sample is water content, you're going to have a wide variety of results. And if you have a target value that you're trying to hit, and a guidance value, if water content is going to shift your interpretation of that guidance value a lot. We wanted to eliminate that issue by drying the fish completely and starting from there. And then instead of using maceration, we used a pipeline, so an enzymatic breakdown of the tissue instead of a mechanical breakdown. And that was to free the toxin from being bound in the tissue. So by shredding the tissue, which is the typical way to start it with the acetone extraction, using an enzymatic breakdown was more efficient at removing that toxin from the tissue and freeing it from its being bound in the tissue. But yeah, I mean, there's a lot of work to be done. It's still complex, but yeah, we're always looking for that rapid stick test, something that we can apply and say positive. But fortunately, we're not there yet.
Then I have a second question that is the correct follow-up of this. You have invested a lot of time in the screening test of way, and you talked about it. Very important to talk about the met. I believe a strategy to go forward. But then you mentioned the division sensitivity, and I want to link this with extraction methodology and legislation. Legislation is extremely limited in Europe. There's absent. Yeah. When it comes to assets, if you raise the sensitivity level, you may come up with bad management practice with some fish that's of concern for safety. But then again, we have problem standards. So what do you think should be the strategy to consider the extraction procedure, the implementation of analysis? Because remember that that still has the mount BIOS and special. And then regulation. What should we do this? Because of the complexity of matrix, we don't have validated official protocol for extraction. There is no concept of which the official methodology. There is no level for safety. What do you think is the strategy to have a path forward?
Yeah. So there are questions that you asked about the mouse assay. I'll start there. So the European Union wants to move away from the mouse efficacy. So that's the first step is to move away from these mouse-based assays. That's why we have the cell-based assay. Comparing the two, the cell-based assay is more sensitive to mouse as well. So hopefully we can we can get everybody on board and make that shift, but not everything is always possible in every laboratory, and you have to use what's available to you to protect the public. I think there's two different perspectives that come from different angles for the regulation. So from a consumer perspective, I think you always want to err on the side of caution. You want to make sure that if I were a consumer, then I would say zero tolerance is what I want. And you want the lowest level of detection to ensure that you have no cytotoxin and contained in a product that you may consume. There are still unknowns with low dose. So there are issues with low dose exposure, so repeated exposure. So maybe a fish is below that level that you set at 0.1 or 0.01 ppb. But if you eat the fish multiple times or have a very large portion size, you can still get an intoxication. So like, it doesn't ensure that having a level does not ensure that you're free of risk of ciguatera poisoning. So from the consumer side, I think a zero tolerance is best, and strive to see what's the lowest level that we can detect, and then if we detect something, then make it safe for the consumer. I understand from the fisher's perspective, when you start to look at the food web in these areas where microalgae is present, the more you look, the more you find, and it's pervasive. It's just a factor of this being the base of the food web, and everything consumes that, and it moves everywhere. So really, if you're in an endemic area, or you find ciguatoxins in Gambia discus, or you find it in low-level fish, it's going to be throughout. And so that makes it difficult from the fisher's perspective, because you're now saying that you can't fish these species, you can't fish these sizes, you can't fish these regions, and it makes it difficult to make a living. So it's a difficult kind of place to be, is between these two important fractions. So what we want to do with prediction is look at some of these environmental factors and say, okay, how can we match these with what we're finding in the food web? And can we get ahead of this? And can we predict it and say, okay, maybe close a certain region for a certain period of time, or a certain area, or maybe stay away from fishing in these regions. And that's kind of naturally what a lot of the fishers in these endemic regions have done. Is they've realized through the hard way of where toxic fish are and what species are toxic, and they've kind of gravitated to regulating themselves. And because obviously you don't want to poison your consumer and the person you sell fish to. So we're kind of trying to catch up to them in the sense of saying, okay, what's worked for you as a fisher in this region, and then can we verify that with data? Can we try and figure out what's causing that with all the tools that we have in terms of remote sensing through satellites? We're using wave action as a descriptor for toxic versus non-toxic regions. We found that to be mostly accurate, both in the Caribbean and in the Pacific, in 2 independent studies. So I think we can get there. There's a lot of work to do. But yeah, when you get that line between selling a fish with toxin and a consumer who does not want any toxin, it's difficult.
No, thank you, because you answered the first question. I was going to go to chapter 2
Okay.
on this regional approach, whatever which is and in your study, that was a hard study, and definitely the link between the algae and it's complex.
Yeah.
You focused on the fish, but I think that is the approach to go.
I think so.
From a regional experience, from a global perspective of Primavera, know what happens at a regional level. But then comes the complexity of your fourth chapter, no? They can come from any region in the world, and you will have the data. And I was quite surprised of the contradiction chapter, the risk of one analysis with one fish getting an overall picture of the stock.
Yeah.
But in this case, the stock was very homogeneous.
Yeah.
I think an exception.
Yeah. So that's again. So there's 2 different classes of thought with an outbreak of ciguatera. Because we know that Ciguatera can be very sporadic within and among fish. So you can go to the same area, catch two fish, one fish could be positive and one fish could be negative. And this kind of thought process is applied to an entire lot. So if we have 8,500 kilos of fish coming in, and we find one that's responsible for a poisoning event, you kind of assume that that same small local area applies to the larger, so that maybe it was just that one fish that was the bad fish, and the rest are fine, and you can continue selling them. Yeah, we didn't find that to be the case, and I don't want to point out Fabio, but he found that as well in some of his studies, that a subsampling of a larger lot was finding a lot of toxic fish, all of them essentially, which is, to me, that's amazing. And I wouldn't have thought that as well. I would figured you have a spectrum, right? Some fish are toxic, some fish aren't, but to have all of them toxic and all of them under the guidance points to another problem. And we have some follow-up studies that we want to get to the bottom of this. So I hope in the next 2 years we can resolve this. But I think there's some interesting stuff to keep digging at. But I want to point out something that I forgot to mention was that the fish from Vietnam were also mislabeled. So from the consumer's perspective, they assume a certain species that they're purchasing, but that's not the case. It's not the actual species. So we verified it with DNA barcoding, and it was found to be another species. So it was presented as Lujanus malabaricus, but it turned out to be Lujanus bohar. And Lujanus bohar is known to be a ciguatoxic species. So whether or not the consumer would have taken that into account and looked up whether this is a risky species for Ciguatera is another thing, but they were not provided with the correct information. This is extremely pervasive in seafood in general, that there's mislabeled. That one species is substituted for another, either for financial reasons or whatever. So it makes it difficult from the consumer's perspective to know what they're getting and to know what risks they may be exposed to. So this is another problem that we're trying to tackle, is food authentication.
So why do you think that is wrong? Because once you have the scientific or technical data, then it's got to manage from our perspective, manage it from a social perspective. Okay. Then I go to chapter 1, the introduction, but I will just specifically work on one issue is that the 1.7 is the long-term risk for Ciguatera and the link with people that are exposed. Yeah. How can we manage patients?
Yeah. So there's a really interesting phenomenon with Ciguatera is that somebody that's been poisoned, they may recover from their immediate symptoms, but maybe 6 months down the road, they may have an alcoholic beverage or coffee or tobacco, and their symptoms will reappear. And it's mind-boggling, really. We don't have a firm grasp on why that may be occurring. Maybe resolubilization of the toxin, maybe something happened in metabolism and the toxin was re-released and you're having another episode of Ciguatera poisoning. And that's another issue with the low dose exposure. So, maybe you have a fish, it's possible that you have very, very low amounts of ciguatoxin, but it's enough to kind of push you over the limit if you have some existing in your body to have a poisoning event. So there's a couple of different ways that those symptoms can reoccur, but yeah, their association with coffee and tobacco or unrelated fish, or and why the symptoms reoccur is one of the great mysteries, I think, for Ciguatera. Yeah, we need a very multidisciplinary approach. We need standards and things to look at this. It's an interesting question.
Well, I will stop here. I hope we can talk just before maybe.
Thank you.
Okay, so I want to congratulate for your great thesis. So my question regards the generation of this improved cell line for testing. So I practically got the rationale behind. So you want to increase accuracy, precision of the assay, and sensibility.
Yeah.
But you achieved this generating a cell line cultivated in a chronic concentration after a chronic treatment with the ovine and veratridine.
Yeah.
So usually when you cultivate receptors with their ligand, often the secondary and tertiary structure of the receptor change. So you never test, for example, potency of your standards. So instead of measure viability, just for the sake of be sure that your receptor were still working in your neuro QA cell line, could you just measure the sodium channel activity just for one, and then move to test them in the high-throughput screening the viability?
Yeah, that's a wonderful approach and a way to really drive at what's underlying that change. And we know functionally that this modification has resulted in a functional change that we can measure and we can repeat. But the underlying question of why, what has changed and what is happening, how did we modify the cell, was a burning question. This is something I will shift back to the presentation. We made an approach at this. This is using in Professor Barley's lab as well. I want to recognize all the people that helped me here. And we tried to do just that with modifying the cell line and growing them, then extracting the cells, determining the protein concentration, applying the Western blot, as well as doing an antibody test. And we looked at pan-sodium channel expression as well as the ATPase. So guanine and veratridine have these modes of action where veratridine affects the sodium channel and guanine shuts off the ATPase. So we wanted to see how the addition of guanine and veratridine in the culture was modifying the cell to make them more resistant to these. So what we found was a reduction in the expression of protein for the pan-sodium channel. And we also found an increase in the expression for ATP. So if you can imagine lower numbers of channels, but a more powerful pump to kind of match that difference. Unfortunately, we were unable to reach a conclusion in this work due to the pandemic. But this is something I hope that we can conclude and continue. There are also fluorescence-based assays that we can do staining and look at the expression of channels and see visually if there's a difference between the modified and unmodified, so we can kind of drive at what's causing that. There's also metabolomics, so we've done the extraction, and we wanted to look at the metabolomics of these two different cell lines and see if we can find differences through that as well. So we have a couple of tools that we want to apply and really want to nail down the reason that we saw that modifiers.
Still on this topic, why not try to create a cell line just using one of the two drugs? Why create a cell line that is sort of resistant for both? I would say, in other words, do you know if the problem of cell viability was veratridine or ovine? So would it be possible to generate a cell line resistant, for example, only to ovine, so the other inhibitor, in a way that at least your receptor is untouched?
That's a good question. I have not had to look back at some of the data. I don't think I've applied just one just to see if we were able to replicate it. Based on the literature for the development of this assay, the veratridine works in a similar way to sigma-toxin. So that's why I kind of called it the signal booster. So it binds to a similar site, they work in concert, and the guanine shuts off the ATP. So without the addition of both of these compounds, the cell can kind of compensate. So I guess it would be, if you were to eliminate veratridine and only use sigma-toxins and guanine, you would have the same issue of not having your signal boosted, so to speak.
No, my question was about to generate a line resistant to ovine, and then apply your normal assay with both the drugs.
Okay.
It will allow you, during the the phase of a chronic treatment to at least leave your receptor untouched.
Yeah.
Because you said now in the second part of the presentation that you got some sort of modulation of the activity of one channel versus the other.
Expression.
Yes. For example, this expression is compensated with the expression of other sodium channel that maybe work for the homeostasis of the ion that you your assay.
Yeah, no, that's correct. There are multiple sites, and there are 4 alpha subunits on the sodium channel. And yeah, no, but that's a good idea to modify one and see if we can do the least amount of change with the highest amount of action. Yes, that's something
I would recommend it because a drastic change of the secondary structure, for example, would not allow you to identify new toxin, maybe that are slightly changed and less fitting to the new binding site.
Yeah, and that is something that's on the list. So there are other marine toxins that work in the opposite effect. So tetrodotoxins that block the channel, and to use this modified line to see how those toxins can be detected, or what kind of changes we can expect to see in our detection. But yes, it's important.
Okay, thank you a lot.
Thank you.
Okay, now we move on to the last candidate. It's Raffaello Masselli. He's online.
Hi to everyone. I'm sorry if I'm not there, but unfortunately I took COVID.
Okay, so the thesis is entitled Development of a New Food Supplement with Anti-Inflammatory Activity for the Relief of Symptoms of Prostate Hypertrophy. You can share your presentation.
Yeah, surely. Can you see the presentation?
Yes, yes.
Okay, can I start? Okay. I focus my PhD project on the development of new food supplements with anti-inflammatory activity for the relief of the symptoms of benign prostatic hypertrophy. Prostate disorders are one of the most common problems related to the aging of the male population, which affect the 60% of the men between the 50 and 60 years old. These disorders can mainly linked to 3 conditions: an inflammatory state, the prostatitis, the prostate cancer, and the benign prostatic hypertrophy. The American Urological Association guideline has defined the benign prostatic hypertrophy as an histological condition that refers to the proliferation of the smooth muscle cells and epithelial cells within the prostatic transition zone. A recent meta-analysis published by Nature through systematic research on the major scientific database for the first time estimates that the global prevalence of BPH is the 14% in the individuals up to 40 years old and 37% in individuals aged 80s and older. The most common complication of BPH was the acute urinary retention, chronic urinary retention, recurrent urinary tract infection, formation of bladder calculi, hematuria, and bladder wall and kidneys. A wide variety of treatments are available for BPH, including pharmacological treatments, alpha blockers, and 5-alpha reductase inhibitors, and minimally invasive therapies and surgery. The alpha blockers work by relaxing the smooth muscle cells, inducing a significant increase in urinary flow and obstruction, improving the obstruction symptoms. The most used are doxazosin, tamsulosin, and silodosin. And the 5-alpha reductase inhibitors block the enzyme involved in the metabolization of the testosterone into dihydrotestosterone, reducing the size of prostate gland and restoring the urinary function, improving the obstruction symptoms. The most used are the dutasteride and finasteride. But unfortunately, these drugs are not free from side effects due to the adverse effect of drug currently used in therapy of BPH, which particularly affect the subject quality of life. Increasing attention has been focused on the study of biological activities of vegetable extract traditionally used in medicine for the treatment of BPH symptoms and dysfunction. To date, the most studied and present on the market are those derived from Pygeum africanum, Serenoa repens, and Cucurbita pepo, which active compounds are phytosterols. Today, literature data show that Epilobium angustifolium, traditionally used in the treatment of BPH, was an active ingredient, is enotein B, has a strong anti-inflammatory and antioxidant activity. Epilobium angustifolium belongs to the Obranaceae families, includes over 200 species spread across temperate and cold regions, and Epilobium angustifolium is used for wound, skin, and skin disease in traditional medicine. The monograph of Epilobium angustifolium, drawn up by the European Medicine Agency, defines the traditional herbal medicinal product for the relief of lower urinary tract symptoms, the LUTS, related to benign prostatic hyperplasia after serious conditions have been excluded by a medical doctor. The product is a traditional herbal medicine product for the use in specified indication exclusively based upon long-standing use. Therefore, except in severe cases, the use of epilobium-based preparation is recommended to the treatment of LUTS deriving from benign prostatic hypertrophy. Also, in the ministerial decree of 10 August 2018, which lists all the botanicals accepted for food supplements in Italy, Epilobium angustifolium and parviflorum have as an official claim the functionality of prostate. During my 3 years of PhD, I therefore concentrated on exploring the chemical and physiological basis on the activity of Epilobium angustifolium extract. I first determined the metabolic profile of Epilobium angustifolium extract, and subsequently I determined its bioaccessibility in vitro and bioavailability in vivo. Finally, we evaluated the effectiveness of the dry extract in the treatment in BPH patients by a monocentric randomized double-blind placebo-controlled clinical trial. In the first part, I determined the metabolic profile of Epilobium angustifolium extract. Produced by the aerial part of Epilobium angustifolium. The following are the characteristics of the mass spectrometer used for the metabolic profile of the Epilobium angustifolium, and the most important things, we used an analyzer that is the linear triple quadrupolar Orbitrap with an electrospray SESI. The other parts are the phases used, and the mass detection was performed in negative ion mode as follows. We used an Epilobium angustifolium extra standardized to contain more than 15% of enotein B, and the extract was analyzed by the means of UHPLC-LTQ Orbitrap to obtain its metabolic profile. 42 compounds were annotated by UHPLC-HRMS as shown in the slide, and we identified 8 organic and phenolic acid, 1 sugar, 1 tannin, 3 elagitannins, and 29 flavonoids, including enotein A and enotein B. Moreover, we evaluated the in vitro bioaccessibility. To verify the effect of orogastric and duodenal digestion processes on the chemical composition of Epilobium angustifolium extract, we followed the protocol performed for the first time by Minekus et al. In this publication. As we can see in the figure, we start with an oral phase with the simulated salivary fluid with amylase 75 units per ml for 2 minutes at a pH of 7 at 37 degrees. After we performed the gastric phase with simulated gastric fluid with pepsin 2000 units per ml for 2 hours at a pH of 3 at 37 degrees. At the least, we performed the intestinal phase with simulated intestinal fluid plus pancreatine and pure enzyme like bile at a concentration of 10 millimolar for 2 hours at pH of 7 at 37 degrees. As we can see in the slide, the mean peak area reduction percentage after orogastric digestion, revealing a degradation process when compared with the peak area registered before digestion. In particular, a great percentage reduction was determined for camferolo exoside. And camferolo coumaryl glucoside, 84.70% for camferolo exoside in orogastric digestion and 52.31% for orogastric digestion. After that, we evaluated for the same compounds the degradation from the duodenal digestion, and we evaluated the same from the orogastric digestion for the camferolo exoside with a percentage of the mean peak area reduction of 81.87%, and after that we evaluated the degradation of the most important compound in Epilobium angustifolium extract, the enotein B, the most active compound, and we evaluated a reduction of the mean peak area percentage in the orogastric digestion of around 17% of degradation, and after duodenal digestion the 20.76 percentage reduction. After that, we want to evaluate the bioavailability of these compounds in vivo. The in vivo bioavailability of Epilobium angustifolium constituents was investigated in plasma of mice after acute treatment after administration of Epilobium angustifolium extract. For this purpose, we used the CD1 male mice with an age of 10-14 weeks were used for all the experiment. The experiment animals were acutely orally administered by the use of gavage with 0.6 milligram per mouse dose of Epilobium angustifolium, corresponding approximately to a dosage double expected for the usage in humans, considering that the daily intake for humans range are from 500 milligrams to 750 milligrams per day. Blood samples were collected applying the intracardiac procedure in enflurana anesthetized mice using a syringe prefilled with citrate of sodium at 5, 10 and 20 minutes from the oral gavage. After that, we extracted the polyphenols from the blood of mice and we analyzed that by HPLC-MS method. Aiming to detect the Epilobium angustifolium metabolites occurring in the mouse blood samples after treatment in Epilobium angustifolium extract at 5, 10 and 20 minutes, we evaluated the levels of two important polyphenols, quercetin and camphorol. We evaluated the levels of quercetin and camphorol more important important at 10 minutes, and after we evaluated the extraction of these two compounds after 20 minutes. After that, we evaluated with the same blood collection procedure in vivo absorption after prolonged treatment. After a daily administration of 0.6 milligram per mouse, after 24 hours, 1 week, and 2 week repeated dose oral gavage. After that, we extracted the polyphenol from the blood of mice, and we evaluated the levels of them in with UHPLC MSM analysis. Following the prolonged treatment of mice with Epilobium angustifolium extract, both plasma and pellets obtained from the centrifugation of bloods collected after 24 hours, 1 week, and 2 weeks were immediately analyzed. We evaluated the Epilobium angustifolium metabolites, especially the urolithins. The urolithins are some secondary metabolites produced by the gut microbiota from ellagic tannins and ellagic acid that are very important into antioxidant pathway and other important function. Urolithins A and urolithins B were identified and quantified in plasma after 24 hours, after 1 week and 2 weeks, and we show the total concentration of urolithin A and urolithin B. The results show that after 24 hours of treatment with Epilobium angustifolium extract, the concentration of urolithin B is higher than the urolithin A, while after 1 week and 2 weeks, their concentration are similar. At least to evaluate the potential of Epilobium angustifolium activities, we want to explore the effectiveness of this activity by a monocentric randomized double-blind placebo-controlled trial. This controlled trial was performed by the Samnium Medical Cooperative to evaluate the effect of Epilobium angustifolium extract food supplements on male population suffering from a BPH diagnosed through prostate ultrasound, blood test, and EPSS score. The study was a double-blind, both for the investigators, physician, and the enrolled subjects. Was blind about the treatment, and the study flow chart showed in the slide was according to the Consort Pro reported guidelines. The participant in Epilobium angustifolium monocentric randomized double-blind placebo-controlled trials was treated for 6 months, and the treated group took 1 ardogastrosectant capsule per day containing 0.5 grams of extract corresponding to 2 grams of aerial part of Epilobium angustifolium, and the control group took placebo. The participant received oral and written information regarding the study before they gave their written consent, and the study was approved from the ethics committee of the scientific ethics committee of the ASL of Benevento. After that, we carried out in accordance with the Helsinki Declaration, and this study was listed in DSR CTN registry with this information that you can see in the slide. The participants are 128 male subjects, 70 in the treated group and 58 in the placebo group, recruited by the Samnium Medical Cooperative. As we can see, the most important inclusion criteria that we take in consideration for this kind of study, we took patients that have an history of BPH for at least 1 year, that have a score ranging of DPSS, the International Prostatic Symptom Score, ranging from 8 to 19 with moderate symptoms. They have to have, they should have a prostate volume ranging to from 25 centimeter cubic to 70 cubic centimeters, no medication intake for the BPH prior to baseline assessment and during the study, and the post-void residuum ranging to 30 to 200 cubic centimeters, and a prostate-specific antigen lower than 4 nanogram for ml. The subject was excluded from the double-blind placebo-controlled trial following this exclusion criteria. That for faster, I don't talk about it, but you can see in the slide. The primary endpoint of the monocentric randomized double-blind placebo-controlled trial was to investigate the efficacy of the 6-month daily dose of Epilobium angustifolium extract to reduce the post-void residual volume and the prostate volume and weight in subject with mild and moderate BPH assessed at the baseline at the time 0 and after 6 months control at the time 3. As a secondary outcome, we want to know the assessment of symptomatology reduction using a validated symptomatology scale, such as the International Prostate Symptom Score, DPSS, the number of urination during the night before each clinical visit, and neutrophil to lymphocyte ratio to evaluate the inflammation state of the patients. And after that, we evaluated the prostate-specific antigen assay that were evaluated at time 0, time 2, and time 3. After that, we want to be sure about the safety of the product, and we evaluated the hepatic and the renal toxicity by evaluating creatinine, bilirubin, direct and indirect and total, prothrombin, aspartate transaminase, alanine transaminase, and cholinesterase. This kind of analysis were performed at time 0, time 1, time 2, and time 3. These are the characteristics of the study population, demographic, and clinical data at the baseline. The most important thing is that we can see the EPS score is around 13, the volume of the prostate is around 45 cubic centimeters, and the other value at the baseline are concordant to our inclusion criteria. We can see the age of population is around 65, more or less, age, and these are the characteristics of the study population. As we can see in these slides, all the parameters after the 6 months of treatment in the treated group was ameliorated and decreased in the International Symptom Score, the echo-RMP, and the urination during the night. Looking at the results, we can see how the volume of the prostate did not significantly change either between the time 0 and time 3 or between treated and placebo group, but depending on the age of the subject, as we can see in this graph. In the treated group, the EPSS score significantly decreased, but in the placebo group, as we can see, by the blue line, is slightly increased. We can see other results about the clinical study, and we can see that the value showed that the frequency of the subject with a low residual urine volume in the bladder significantly decreased in the placebo group. In the treated group, the value showed that the frequency of the subject residual urine volume in the bladder significantly increased, while decreasing subject with residual urine volume higher than 100 microliters. After that, Moreover, we evaluated the number of urination per night, and we see that showed that the frequency of the subject with a low urination per night decreased in the placebo group. But the number of urination per night showed that the frequency of the subject with a low urination per night significantly increased while decreasing subject with a high number of urination per night. The most important things during the 6 months of treatment, non-renal and hepatic toxicity was evaluated by looking at the result at the time 0 and time 3 of creatinine and the glomerular filtration rate, moreover the neutrophil lymphocyte ratio. And the principal investigator of the study judged that the application of epilobium angustifolium capsule was considered well tolerated. In conclusion, 42 different compounds were identified in epilobium angustifolium extract. The polyphenol contained inside suffered from a degradation after both orogastric and duodenal in vitro simulated digestion process, suggesting that gastro-resistant coating agents are required to preserve the bioactive components from orogastric digestion. Moreover, in vitro data underlined the presence of urolithins only after a prolonged treatment, confirming that the gut fermentation process requires at least 24 hours to reduce urolithins. Epilobium angustifolium extract food supplements can be used in subjects with a mild and moderate BPH to improve their quality of life by reducing post-voidal residuums, all the symptoms, and consequently nocturia and general renal function. Epilobium angustifolium food supplements is well tolerated, and it did not show hepatic and renal toxicity, and this study confirmed the safety of epilobium angustifolium extract, as no subject report adverse effect related to epilobium angustifolium treatment. I want to give my special thanks to my current tutor, Professor Maria Daia, my past tutor, Professor Mariano Stornaiolo, and my PhD coordinator, Professor Maria Valeria Dauria, all the physicians involved in the clinical trials, as you can see in the slide, like the Unilab Sannio that performed all the analysis during the monocentrical double-blind clinical trials, the research that work in collaboration with me, Pietro Campiglia, the Professor Pietro Campiglia, and Eduardo Sommella of the Department of Pharmacy, University of Salerno, and really a special thanks to all my colleagues that give me the pleasure of working in the Department of Pharmacy for these 3 years. And the last but not least, the EPO SRL, the company which hosts me for 7 months for other study about other different vegetable matrices that I worked on. Thank you for your attention.
Okay, we can start with the question. Professor Santi.
Thank you. Thank you very much, and thank you for your very interesting presentation and for the work you have done. When you have clinical trials in between is always complicated, but you managed to complete, let's say, the work from the in vitro characterization to the in vivo administration. I have a couple of questions regarding the extract that was administered to this patient, this voluntary or patient, whatever they are. Is this a commercial extract?
This kind of extract is start from studies that I do with the company in which I worked, and I cannot talk a lot about the preparation of the extract because we have a confidentiality agreement, but I can say that we used statistically experiment like the design of experiment to perform a better extraction of epilobium angustifolium extract, and the titers of enotein B contained in epilobium angustifolium extract is around 15% of enotein B to a maximum of 20%. 70% of an OTMB. But I cannot talk a lot about more because I have this kind of agreement.
I can understand. Actually, I had a few more questions about this, but I will avoid asking.
But I can try.
Yeah, well, I mean, is not such a big problem. From what I have understood, it is a product that has been developed expressly for this project, so it's fine. No, I have a question about what you call the bioaccessibility, that is the in vitro dissolution test. And very interesting, you used these fluids simulating the, let's say, the body. Have you tried also to simulate the effect of food on extract stability and absorption? You know that there are biorelevant fluids simulating the fed state.
Yeah, but at the moment we did not evaluate this kind of degradation supporting by the foods in this kind of assays. We only evaluated the degradation after the orogastric fluid and after the duodenal fluid. Mm-hmm. But after that, performing the in vivo bioavailability, we evaluated how the compounds in bloods and urine can be changed by the absorption of food and other stuff from the mice.
So the in vivo data on mice were done in fed state, sorry. The extract was done without food.
We tried just at times, but it's difficult to understand it in mice when you give them the food with supplements of the extract, and we prefer to do the gavage every day to the mice because it's the only one way to know how much extract are you giving them.
Yeah, sure. No, probably this the effect of food can be tested in vitro, of course, to see if there is a change in stability, and in vivo on man when you administer them. But this would be another study inside the study. So
another project.
Another project, and the next PhD thesis.
Yes, sure.
No, I think it's very interesting, and if I understood well, the in vivo clinical trials were done for 6 months, right?
6 months of treatment.
With this, how did you choose this 6-month period? You had preliminary data indicating that you need at least a few months, or it was by chance?
We evaluated with the power analysis the right month contribution with the physician about this, because we have to do a long-standing use of this kind of extract to change a little bit the metabolites pathways, to try to change a bit the situation of BPH in patients. And we evaluated that 6 months is the minimum time to evaluate the beneficial effect of Epilobium angustifolium extract administration in patients. Mm-hmm. We evaluated that comparing with the other kind of studies done for the other extract, for the other market products like Pigeum, Serenoa, and the other studies, the other clinical studies, was performed like 6 or 9 months.
Mm-hmm. One just last short question. How do your results compare with the relief of symptomatology that you have with drugs like finasteride, for instance? I mean, you reach the same level of benefit for the patient?
Yes, surely we know that the useful of drugs is more important and the activities directly to the special targets. But with this kind of extract, we relieve symptoms in an homogeneous way, and we have a decreasing urination per night, the post-void residual. But the important stuff that in this kind of patients that are mild, moderate, that not access at the first time to the drug therapies, is important to use and food supplements that can improve the relief of symptoms before they can start to have the drug therapies, because we know that with alpha blockers, 5-alpha reductase inhibitor, phosphodiesterase inhibitors, they have a lot of adverse effect.
Very well. Thank you very much, and congratulations again for your work.
Hello. Well, I'm glad that having got it.
Sorry, I cannot listen very well.
Can you hear me a little better now?
Yeah, thank you very much. Probably now I can listen to you.
I'm glad that having got it, you're in a situation to respond to your questions. So, I have two technical questions regarding methodology. One is, you approach the non-toxicity criteria self-conscious.
Sorry, I cannot understand the second part, the approach, the method.
Vediamo che cambiando il microfono si sente meglio, no? Abbiamo
Can you hear me?
Yeah.
Yes?
Yeah, and I can listen to you now better.
Okay, thank you. So, I have two technical questions. One is regarding there's an assay of cell viability, and you estimate that 78% viability is like a non-toxic criteria. Which were the criteria to fix that? That was in page 67. You approach the concentrations at which the extracts are not toxic, so you consider that 78% viability is not toxic. How did you fix that value?
If we are talking about the toxicity in cell line.
Yes, exactly.
Okay. Yeah, I done that, but I cannot show this kind of data inside my presentation, but I do the MTT to evaluate this toxicity in vitro, and because we done other experiment in cells to evaluate the effectiveness and the activity of this extract, to evaluate the antioxidant and the anti-inflammatory activities in LNCAP cell line and THP lymphocyte cell line, and we evaluated by MTT the toxicity, and we choose the right concentration to treat the cell line, if this is the question.
No, well, my question is, if a 22% decrease in viability, you consider this not toxic?
Yeah, it is a little bit toxic in some concentration at 22%, but after that we try to find the right concentration. But probably I don't understand for the microphone the right question.
Well, it was just a way of the criteria used to fix the non-toxicity concentration. Okay. Then I have another technical question regarding the biosensitivity study, and it's a curiosity. The standard deviations that you report in your analysis of the degradation of compounds is quite low. Is this the standard deviation of the analytical measure, or is it a standard deviation of 3 different enzymatic exposures?
No, this is the standard deviation of the analytical methods. Yes, is very low, and as we can see, all the degradation of the compounds inside. So because we don't separately the orogastric digestion and the duodenal digestion, and we evaluated this kind of degradation of the different samples. I repeated 3 times this experiment to have the standard deviation.
And would you expect larger variability when repeating the enzymatic digestion? I mean, the work I understand was performed after enzymatic exposure, but did you test different enzymatic exposure to the extract to evaluate the variability?
I'm really sorry, but now I cannot listen nothing. So,
can you hear me a little better now?
A little bit. I try. Okay.
My question is regarding the enzymatic process. Do you expect high variability, for example, in the degradation of your extract? Did you study the variability between repetitions of enzymatic exposure?
Yeah, I expected the degradation in the enzymatic by this kind of experiment, and for that reason we choose after that to use an ardogaster-resistant capsule to administer this kind of extract to the patients, and this is the reason why we do this kind of enzymatic assay.
Then you did a clinical trial, and as I understand, there was a first clinical trial of this extract, so I think that's a step forward. And you were critical in your discussion about it, that you were limited by time. How would you improve clinical trials for the potential description of the effect of your extract?
How I can improve the clinical trial?
Yes. You in your discussion, you were stating that you were not able to extend the clinical trial to 6 months, if I understood correctly. Does this mean that I understood that there was a certain level of improvement? How would you improve the clinical trials?
Yeah, surely looking at more time, but we don't want to give a special stress to the patients, and 6 months it's enough to evaluate it. But if we can see for more time, like 1 or 2 years of treatment of the patients, can surely be more effective, and we can see more results about it, and we can evaluate other parameters of the prostate, and using like other kind of symptomatology score to evaluate more about the patients. But for this project is enough to evaluate this kind of parameters: urination per night, post-voidal, the echo volume, because the physician performed an transrectal echography of the patient to evaluate the volume of the prostate. But surely we can improve this kind of clinical trials, probably doing a multicentric studies with different kind type of population.
Okay. And do you think it would be interesting, now that you have had results on the efficiency of this extract, to go back to its composition and try to better identify the bioactive substances that are responsible for the beneficial effects?
To identify better the mechanism of action.
Well, the mechanism of action and the compounds that are responsible for your positive effects.
Okay. Yeah, surely we think about the enotein B is the most active compound, but we want to understand more about the mechanism of action. But we know about this new kind of nutraceutical science-based extract that the phytocomplexes act and interact for the relieving of symptoms and the activities. And we want to know more about the single active compound, but we believe more that all the phytocomplexes is active in this kind of pathologies.
Okay, then I want to congratulate you because of the extension of chapters 4, 5, and 6, and especially 6, because it shows a very rigorous approach to have an overall picture of the phytotherapeutic approaches to this disease. And my question is, which other botanical sources would you like to investigate in addition to the one you, according to this overall view?
Yeah. During my period in the company, I explored other matrices that I cannot talk about it, about the name, but I can show you a slide about it because my project is continuing. Just give me a moment that I share my screen. This is the research that I do in EPO, and more than the Epilobium angustifolium, I evaluated two plants, the plant X that have an anti-inflammatory activity containing enotein B, and the plant Y that active is in treatment of erectile dysfunction, because the erectile dysfunction is one of the most comorbidities that we evaluated in patients with BPH. And I started with the evaluation of the extraction that was optimized to obtain an titer of enotein B and other values, but I want to explore firstly by starting with my in vitro approach with the orogastric duodenal digestion, and I do the first experiment to know something more about it, and after that I want to improve these two matrices, these two plants inside a new food supplements that contain these three plants to evaluate the potential in another clinical trial if it can function.
Okay, thank you very much.
Thank you very much.
Okay, thank you for your presentation. Can you hear me?
Yeah, perfect.
Okay. So at the beginning of your presentation, you started saying that you found enotein A and enotein B in your medics.
Yeah.
But then when you were detecting this compound after oral digestion, duodenal digestion, suddenly enotein A disappeared. Where did it go?
Yeah, surely because we want to focus more about enotein B and the other different structural compounds because the epilobium extract is titrated in enotein B, and we think about the enotein B is the most active compound, and we choose in this experiment, but with other kind of mass spectrometer we see more about the enotein A, and but in this situation, in this assay, we took in consideration all the enotein B.
So you are saying that enotein A is still there and it behaves like enotein B.
The enotein A?
So enotein A is still behaving like enotein B in your oral digestion.
Yes. The enotein A still have a degradation in the orogastric duodenal digestion, but for faster conclusion here, we don't show the result about it.
Okay, the second question is about the percentage of uric A and B that you found in the red blood cells.
Yeah.
So, can you envisage any effect that this compound had on red blood cells?
Okay, yes, it's interesting because finding this kind of compounds inside red bloods is interesting because they can act like an antioxidant in red blood cells. And we don't have literature data about it, about urolithin type A and type B in red blood cells, but we know more about flavonoids and other polyphenols and antioxidant substances that can act like an antioxidant inside red bloods, and this can be useful in a lot of pathologies, because when we have a lot of oxidant inside red bloods, it can bring the red blood cells to hemolysis, and we want to don't have this kind of effect, and we want to improve the levels of antioxidant substance like urolithin A and urolithin B in red blood cells concentration.
Okay, my last question. Simulating the digestion by the oral step and the gastric step and the duodenal step, basically you predicted the stability of your molecule, okay? But then you did the in vivo experiment in mice, measuring the product that you were expecting in plasma in a living organism. So, in your opinion, did you get coherent results between the two assays? So, were you expecting such an amount of urolithin B in the blood of your animals?
Yeah, surely the results is a little bit different, but we use this kind of assays for two different ways, because with the first assay, the orogastric digestion in vitro, we want to know in which part we have to protect the extract to know more about which form, which pharmaceutical form we have to give to the patients. To give them the beneficial effect of the Epilobium angustifolium, but surely in vivo the results are a little bit different, because we evaluated the levels of these components only in the different parts, because we do the oral digestion, the gastric digestion, and duodenal digestion separated to know more about the degradation. But surely, seeing all the accessibility in vivo, we can know more about it and in which part of the tissue can the bioactive compounds can arrive. And we can know more about the pharmacokinetics by in vivo, but we have to perform it.
Okay, thank you a lot. So the session is concluded, finished. So now the committee has to meet.
We transfer to another team group in order
So we
final assessment
so we meet again in
please here in about 45 minutes.
We have to leave the session.
Write
Yes.
the minutes of the exam. I will be in touch with you for the final official proclamation of the exam.
At the end of the
Do you believe 45 minutes are enough?
Yes.
Okay. Do you want a coffee, Giorgio?
No, vado in back.
Vai in bagno, va bene. Sai dove sta?
Sì, glielo spiegate alla fine del corridoio. Questo qua chiudiamo.
Sì, ho fatto quella del comitato. Ieri l'ho fatta.
Questi istanti, allora lasciamo questa stanza e ci ritroviamo sulla stanza del comiti.
Predisposta su Teams sullo stesso canale c'è un'altra stanza come spesso si fa per gli esami per il comitato.
La contatto io su questa stanza, va bene?
Va bene, grazie.
Grazie a lei.